Let me start right now with Dr. Laureen Hill. Dr. Hill, Senior Vice President, also the Chief Operating Officer for New York Presbyterian Hospital. She's also a board-certified anesthesiologist. Dr. Hill, I know you're very busy. Thank you for taking some time for us.
Hi, Craig.
Excuse me for having to scream over the wind and scream over our distance. What's going to happen here roughly this time tomorrow? The patients who come here, what can they expect?
So roughly tomorrow, we'll be opening up the Ryan Larkin Field Hospital and accepting our first patients. These will be COVID patients who are admitted for ongoing hospital care, medical surgical level care, where they will require ongoing supplemental oxygen in addition to all of their chronic medications. So we are outfitted here to be able to accept up to 216 of those patients, and we will be ramping up over the next few days.
I understand that again, the patients who will be coming here are exhibiting mild to moderate symptoms. What constitutes mild to moderate, and what would happen if someone came here with those symptoms, but while they were here, they took a turn, so to speak?
So mild to moderate symptoms, it's a spectrum. So mild symptoms might be mild shortness of breath, requiring low levels of supplemental oxygen, all the way up to patients who require higher levels of oxygen, maybe a little more shortness of breath. They need closer monitoring, closer medical attention. So we anticipate having the entire spectrum of patients within that range. Patients who require critical care levels of care will be cared for down at our Columbia University Irving Medical Center. And that's where we also have a field hospital set up within the hospital to help expand our capacity for critically ill patients.
And Dr. Hill, as we're having this conversation, Jamila, let's show folks again the volunteers as they're having, I guess, Dr. Hill, what would constitute sort of a last-minute staff meeting, last-minute training meeting. 90% or roughly so, former military who volunteered to come in from all over this country to help in our time of need here in New York City. What is that going to mean for the kind of care that these patients can expect to receive?
They will receive the same kind of excellent care that we deliver at New York Presbyterian. These are, as you said, our military veterans, former active duty, and these are people who provide health care in really austere conditions under duress. And so the response from these individuals to come support us and help us with this endeavor has just truly been awe-inspiring. But this will largely be under the command of Dr. Melissa Givens and her Chief Nursing Officer, Dr. Kate Kemplin. They are here to support all of the medics and nurses and physicians that you see training behind us.
And to be clear, this is going to be open not for folks who want to walk in off the street with symptoms. These are folks who are coming in from New York Presbyterian hospitals, to be clear.
Yes, these are patients, Craig, that will be coming either through our emergency departments or maybe coming in from our hospital locations, our brick and mortar hospitals, when they are recovering from critical illness, for example. Those might be appropriate candidates to continue their hospitalization and their recovery from the COVID symptoms. Could be right here in this particular location.
Dr. Hill, thank you so much. And good luck to you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.